Is America's retreat from the global stage leaving the world vulnerable to the next major pandemic? When the Ebola virus rears its head again, the answer may be a devastating yes. Before we dive deeper, if you want to stay on top of everything happening in US politics, hit that subscribe button right now and leave a like. It really helps this channel grow and allows us to bring you more in-depth analysis like this. We're talking about the first major Ebola outbreak since the Trump administration significantly dismantled its global health programs and, in many ways, stepped back from its leadership role on the world stage. And experts are saying, unequivocally, that this absence is being felt deeply. The current situation in Central Africa is grim. The Ebola virus, a pathogen known for its rapid spread and terrifying fatality rate, is once again on the move. But this time, the global response is starting from a fundamentally different, and arguably weaker, position. For years, the United States was the undisputed leader in global health security. We funded critical research, supported early warning systems, and provided the lion's share of resources and expertise when outbreaks like Ebola or MERS threatened to become global catastrophes. We built infrastructure, trained local health workers, and established robust international partnerships. Then came a shift. Under the previous administration, there was a deliberate scaling back. Funding for key global health initiatives was slashed. International organizations that play a vital role in coordinating disease surveillance and response found themselves without crucial American backing. The rhetoric shifted, too, moving away from multilateral cooperation and towards a more isolationist stance. This wasn't just a budgetary decision, it was a fundamental reorientation of America's approach to global challenges, including health. Now, as this new Ebola outbreak spreads, the consequences of that shift are becoming starkly apparent. While the US is indeed sending resources and teams of experts overseas, and let's be clear, those efforts are crucial and commendable, public health and infectious disease experts are expressing serious concerns. They argue that the U.S. withdrawal has hobbled the very systems and partnerships that are essential for an effective and swift response. Think about it, when you weaken the foundations of a house, the entire structure becomes more susceptible to damage when a storm hits. The global health infrastructure is that house. Without consistent, robust American leadership and funding, these systems are less resilient. Early detection is slower, coordination is more complex, and the ability to deploy resources rapidly is diminished. Experts are describing the absence of U.S. leadership as palpable. It means that when an outbreak like this emerges, the world is playing catch-up, and precious time is lost. Who is most affected by this? It's the communities on the front lines of the outbreak in Central Africa, who are now facing a more prolonged and challenging fight against this deadly disease. It's also the rest of the world, because in an interconnected world, no outbreak remains isolated for long. A virus that isn't contained in one region can quickly spread to others, posing a threat to global health security. This is precisely why investing in global health infrastructure and international cooperation isn't just an act of charity, it's an act of self-preservation. The possible outcomes are concerning. A protracted Ebola outbreak could lead to a devastating humanitarian crisis, overwhelming local healthcare systems and causing widespread loss of life. It also raises the specter of further mutation and spread, potentially creating an even more dangerous variant of the virus. Furthermore, it sends a dangerous message to other nations, that when the going gets tough, the United States may not be there to lead. This can erode trust and undermine future collective security efforts. The current administration is now working to rebuild those bridges and re-establish that leadership. But rebuilding takes time, and in the face of an active epidemic, time is a luxury we don't have. The lessons learned from past outbreaks, like the devastating Ebola epidemic of 2014 to 2016, were supposed to lead to stronger, more resilient global health systems. But the question remains, have we truly learned those lessons, or are we doomed to repeat them because of political decisions made back home? So what do you think about this? Is America's withdrawal from global health programs a direct contributor to the current Ebola crisis, and are we risking future pandemics because of it? Drop your opinion in the comments below. I read every single one. The fight against global health threats requires unwavering commitment and sustained leadership. History has shown us that isolationism is not an option when it comes to deadly diseases. The world needs a strong, engaged America. And that starts with recognizing that our own health and security are inextricably linked to the health and security of people everywhere.